The best way to listen to the best of the week is on the Relevant Radio app. Free and always free. Download and share the #1 free Catholic app today in the App Store.
3 in 5 women today have abortion via what's known commonly as chemical abortion. A couple sets of pills, not even required today, that is, to have a medical physician prescribe the pills or to oversee and do any follow-up. Maybe you or someone you know has been through a chemical abortion. We're going to be walking through some of the facts about the abortion pill, how common it is, side effects. My guest today is Dr. Christina Francis. Today we see startling evidence, mounting evidence, medical evidence that chemical abortion is terrible for women. Women are dying from side effects. You've probably heard of the case back in 2022 of Amber Nicole Thurman, where people are trying to blame pro-life laws for the reason why this young woman died. Yet in reality, she died from abortion complications from a chemical abortion. Dr. Christina Francis is with me today. She is the Chief Executive Officer of the American Association of Pro-Life Obstetricians and Gynecologists. Dr. Francis, thank you for joining me today on the program.
Thank you so much for having me, Timmerie. It's great to be with you.
Since 2021, we've seen an ongoing increase in chemical abortion, especially with the decrease in requirements for the chemical abortion pills. You can receive this at many local drugstores now, no physician oversight. I'd love for you to just start by discussing some of the side effects and maybe for those who don't know, a little bit about how chemical abortion works.
Absolutely. Well, as you said, I think it's important for everyone to be aware of because we know that it accounts now for almost 70% of all abortions in the U.S. So the first thing I always like to start out with is for people to understand exactly what chemical abortion is. It's not the same thing as the morning after pill or Plan B, emergency contraception, those kinds of things. Those have their own issues, certainly, but that's not what we're talking about when we talk about chemical abortion. So chemical abortion is specifically referring to a 2-drug regimen. The first drug is called mifepristone, and the second drug is called misoprostol. And women take the first drug. They used to have to take it in person with a physician or another medical professional. But now, as you said, the FDA removed that in-person dispensing requirement. So now women can actually get these drugs online and have them mailed to their home or pick them up at their local pharmacy. And that first drug is a blocker of a receptor for a hormone called progesterone. And many people have probably heard of progesterone. It's a naturally occurring hormone in the body that plays a very key role in early pregnancy. It helps ensure that that developing baby gets all the nutrients and oxygen that he or she needs to develop and initially to implant well into the lining of the uterus. And so by blocking the action of progesterone, mifepristone actually leads to starvation and asphyxiation of that developing baby, causing his or her death. And then about 24 hours later, women take misoprostol, that second drug, and that is a drug that we use in smaller doses, actually in full-term labor inductions in OB. But it does the same thing for women going through chemical abortion. It induces their labor. And so it will cause really severe pain for them, can cause heavy bleeding, and then women will deliver their baby at home. And, I think it's important if people didn't realize maybe that was happening, that last fact that I said that they're delivering their babies at home or in their dorm room if they're a college student, that's a key factor in one of the adverse events or side effects that women have from this, which is significant mental distress. Because oftentimes they're not prepared for that and they're not warned that they will see their baby. And we hear from many women who've experienced this, that, they saw their baby. Some of them even saw their baby moving because their baby hadn't actually died yet. I have not been through this myself, but my heart just breaks, obviously, anytime I hear a woman recount her story.
The number of women in college dorm rooms right now who are sharing their story of literally giving birth to their baby alone in their dorm room, in their bed, and women sharing that their babies are still moving between the sheets. I mean, it is so startling and so heartbreaking that we would even expose a woman to this type of so-called treatment, as they try to call it.
Right, exactly. I think back to my own college days of, the shared bathrooms, and there's no privacy. And I just can't imagine a young college girl going through this. But of course, they're told by the abortion industry that, oh, it's just as safe as Tylenol. It's just going to be like a heavy period. It's nothing like that. It's so much worse. So, there's mental health effects of that, obviously, that women then see their babies and now what do I do? That image is with them then for the rest of their life. But there's also, as you alluded to, there's also significant physical side effects of these drugs. We know that they cause very heavy bleeding. There's actually a relatively high risk that the drugs alone won't complete the abortion and that some of the tissue will be left inside of a woman's uterus, something called an incomplete abortion. And we know, I know you talked about the case of Amber Thurman. For women that are where she was at in her pregnancy, at about 9 weeks of pregnancy, approximately 10% of women at that gestational age will actually need a surgical completion of their abortion because the drugs will not accomplish it. They can get infection from that. And in fact,
what percentage? Sorry, if you could just repeat that, because I've not heard that, because we have chemical abortion. Now, I've seen it for over, 10 to 15 years now in the crisis pregnancy centers. I worked for a number of years there, and we've had women coming in where they were being told to take it all the time at 16 weeks. Now, you're telling me a woman at 9 weeks, such as Amber Nicole Thurman, who had that chemical abortion 9 weeks, what's the statistic of the number of women at 9 weeks taking that chemical abortion pill who will end up needing to go to the ER for because the baby's still in her womb?
Yeah. So at about 9 weeks, 9 to 10 weeks, up to 10% of women will have an incomplete abortion. So will need a surgical completion of their abortion. It depends on what study you look at. Some studies report as low as 5%. But some very large studies from overseas in European countries where they have much better data collection actually show closer to 10%, which, 5% may to some people not sound like that much. But if you think about, let's look at 2023, there were just over 1 million abortions in the US. And if we say, roughly 67% of those were chemical abortions, then that's roughly 670,000 women. So what would 5% of that be? That's over 30,000 women. So it's not an insignificant number. And I think it's really important for us to remember that and be aware of that. And as you brought up, you've seen these drugs given to women who are much farther along in pregnancy. That same study that I was referencing from Finland actually showed that if women took the drugs so at 10 weeks, roughly 9 to 10 weeks, it was about 10%. If they took the drugs just 3 weeks later, at the end of the first trimester, early into the second trimester, that number jumped to 40% of women who took these drugs would need surgery because they would have an incomplete abortion. And not only do they need surgery, but that also means that they're at much higher risk of infection and hemorrhage or really heavy bleeding where they might need a blood transfusion. So that's why it's so important actually that women know how far along they are before they take these drugs, which of course is not being confirmed when they're getting these drugs online or just picking them up at their local pharmacy.
And you also add to the fact that many women are experiencing cycles that are very off with polycystic ovarian syndrome. So the dating of many women's cycles, if they even track it and are aware of it, is very off. And so a lot of these babies could be much further along than they're even considering, or many of whom are saying they're not as far along so that they can receive the less expensive chemical abortion than the surgical abortion. Now, I remember a number of years ago, we had a Planned Parenthood practically across the street from where I was living, and I was in college. We tried to get groups of students out there to pray in front of the abortion clinic. And I remember some of the staff at the Catholic university I was at said, "Oh, well, we don't have to be out there on days they're not performing abortions." And my jaw just about dropped because I said, well, they're prescribing chemical abortion every single day. And some people want to try and say, well, that's not really abortion. It's not the same thing. And I'm astounded when you see now, 10, 15 years later, that the majority of abortions are chemical abortions. It's easier for the bottom line of the abortion industry, and it leaves a woman dealing with aftermath and not the medical community.
Right. Absolutely. Well, and the way these are being dispensed online now really is, I consider it medical malpractice. I mean, I think feminist groups should be up in arms about this, that even if, of course, my primary objection to these drugs is they're ending the life of an innocent human being in that preborn child, but they're also causing significant harm to women. And the way they're being dispensed now, as you said, is just really negligent. And it's requiring patients and their families really to become their own physicians. So to determine for themselves, am I too far along to take these drugs? Do I have any reasons why I shouldn't be taking these drugs, from a medical standpoint? And then how much bleeding is too much? How sick is sick enough before I go into the hospital? They have this invisible and inaccessible provider who just doled out these pills to them. They have no one to go to when they have questions or they're experiencing complications. They're just abandoned to their local emergency rooms, where the emergency room physician or the OB in the emergency room may not have any idea that they took these drugs, which is also very important. They have different types of complications than women that are having spontaneous miscarriages. And so they're seeing a doctor who has no relationship with them and doesn't know, maybe what kind of drugs they've taken, who's trying then to take care of them. This is negligent. And, we keep hearing over and over again from the pro-abortion side that, government is trying to come between a patient and her physician, that we should respect the physician-patient relationship. But where is that physician-patient relationship in all of this? There isn't one. She doesn't have a physician she can go to. And so it really is heartbreaking that not only are women experiencing these horrific complications after being lied to and told that these drugs are safe as Tylenol, but then they don't have a physician that they can go to. They just get stuck going to their local emergency rooms.
And I've seen firsthand from having worked with these women who have gone through the chemical abortion pill process that not only do they not have a physician's oversight or a go-to physician for addressing this, they have so much shame, Dr. Francis, that often they think they deserve what they're going through, and they intentionally don't reach out for help, whether it's a friend, a family member, or even calling 911 because they think they deserve what they're going through, because they know inherently that this was the ending of the life of their baby that they just participated in.
Absolutely. And first of all, that shame and the regret that they feel, on the one hand, I think is very natural, as you said, because they recognize, especially when they see their baby, and when they've delivered their baby, they recognize what's going on. But then they're told by our culture that they shouldn't be feeling that way, right? Because women are being told this is a good thing and they should feel empowered by this. And again, if they had a relationship with either a physician or, you brought up pregnancy centers. I've had the immense privilege of touring several pregnancy centers, working with pregnancy center directors and seeing what pregnancy centers can provide for women, non-judgmental care that will come alongside and support them. And if they're able to talk to them before a woman makes a decision to have an abortion, they can offer her real support and real help that can help elevate her out of her circumstances, in addition to giving her child life. And that's not what they're receiving at the abortion facility. I mean, this as well as I do. They're not being given counseling. They're being made to feel shame. I have heard the same thing from patients that I've talked to when I've talked to them when we've been starting the APR process, and they've told me about their experience at the abortion facilities, even when they went. Many of them felt ashamed. They did not get adequate counseling. And they were just kind of herded along with a bunch of other women and didn't receive individualized care. This is, again, I really don't understand why feminist groups aren't joining with us that are, pro-life groups in really decrying the way that women are being treated through this process.
Because the real pro-woman position is a pro-life position. And this is, I think, what is so important, that whenever we're engaging these pro-life conversations, we're engaging the medical side of how it impacts a woman, along with how this is impacting a child. Because at the end of the day, you still have a woman who has been wounded by abortion in more than one way. You can join me and listen on the Relevant Radio app to Trending with Timmerie live each weekday at 6 p.m. Central. Thanks for listening.